sure that is going to go
No,
really loud on the tape. I apologize. But y'all are chatty. That's okay. We're a fun group. All right. It's 4:30. Let's go ahead and get started with our joint entities meeting. It is Monday, July 21st, 2025. We're here in Coralville. Welcome, folks. And let's just start with going around the table and introducing ourselves. Most of us know each other, but, you know, whatever. My name's Megan Foster, and I'm the mayor of Coralville.
I'm Lisa Green Douglas, and I'm on the board of supervisors.
Josh Moe, Iowa City Council.
Rufina Malone, Iowa City School Board.
Stephanie Gahn, City of University Heights.
Lori Goodrich, Coralville City Council.
Mandy Remington, Johnson County Supervisor.
Lisa Williams, School Board.
Sean Highstone, School Board.
Mike Knudsen, Coralville City Council.
Laura Burgess, Iowa City City Council.
Eric Civic, North Liberty City Council.
Tim Morris, Tiffin City Council.
Nick Pfeiffer, Clear Creek Amana Community School District Board.
Jane Finch, Iowa City School Board.
Mitch Lingo, Iowa City School Board.
Charlie Eastham, Iowa City School Board.
Sean Harmson, Iowa City Council.
Vifix Morais, Johnson County Supervisor.
I was worried if you started going to the right, so I was last. Mayor Chris Hoffman in North Liberty.
Okay, anybody else want to back there?
Molly Abraham, Iowa City School Board.
Tim Kemp, Mayor Hills.
Anybody else on this side? No? Okay. All right. Well, like I said, again, welcome. Looking forward to a very productive meeting this afternoon. We do have a very packed agenda, which is awesome. So we will start with our public comments. We'll do some public comments for about 10 minutes. So if there is anyone that would like to speak to us about anything, just go ahead and step up to the microphone and tell us what's on your mind. Try to keep your comments to about 2 minutes if possible.
I think that you should keep my time for me. Is this working?
Yeah.
Yes, okay, all right. My name is Mary McCann. Many of you know me through the JECC 911 data that I send to your city councils, graphing emergency calls, law enforcement responses, police actions across Johnson County. The rest of my life is spent on a bridge working with at-risk Black teens who have experienced violence and injustice. Recently, 3 out of 5 county supervisors refused funding for an additional juvenile bed in Lynn County. I didn't hear about this from a press release. I heard about it from a pastor. His congregation includes the parents of a teen sent 6 hours away. They can't visit their child. He wanted to know why. Those who oppose funding dismissed law enforcement as incapable of studying their own field. But 12 Iowa City families and their pastor disagree. They see officers silently absorbing criticism while they seek to understand. 2020 was a turning point for local police, but instead of being recognized for the changes they've made, they're expected to remain quiet. If you're satisfied with a single, one-sided narrative, then you've dehumanized the smallest minority in Johnson County, those who wear the uniform. Since 2020, some in Iowa City have adopted abolition of law enforcement as a political identity. A motivated minority votes that way. The media celebrates that. We must ask, is their story the only one worth telling? When I hear it said that police are responsible for racial disparities, I think of the young people I work with. I see how schools, jobs, public spaces fail them. I could blame the systems that inflame their anger. I could blame the police who respond when the anger erupts. But when I look into the eyes of teens, teachers, administrators, and officers, I see sorrow. I flash to childhood memories of the racial terror of lynching in Plainsboro, New Jersey. Town leaders, not law enforcement, riled up white men who burned migrant workers' village. The violence stopped when my mother walked me into the rubble and told me, help them. That story was erased from the town's history, but I will remember. Everything, everywhere, all at once. Time telescopes, and we repeat the same terrible judgments when we discriminate against another minority. We have a long history of othering by reducing entire groups to the worst among them. When the smallest visible minority knock on doors, walk up to cars in the darkness, knowing There are more firearms than people in Johnson County. My breath catches. When they swear an oath to uphold the Constitution and the rule of law, while they serve communities who may reject them, I breathe out. Still, JECC data tells us every town has different needs. Officers understand these needs because they live for them every day. I can only hope that the county and city leadership will understand the times we are facing when the rule of law is under assault every day. We need to drop ideologies at the door and study each other's intent. It's the only path to knowing how we coexist and support the smallest minority living carefully in a place like Iowa 2025. They are not the military-industrial complex. Thank you.
All right, thank you. Yeah, come on in. Is there anybody else that would like to speak to us about anything? Any other public comment? Yeah, come on up to the mic. Introduce yourself.
Thank you, and good afternoon. I'm Cammie Rasmussen. I'm the city administrator in Solon. I'm here because I wanted to say thank you. I want to say thank you to Sheriff Kunkel. Solon Beef Days just happened this past weekend. It's an amazing event. It's an amazing event of small town community. Takes a lot of groups, a lot of people to pull it off. But most importantly, it takes great collaboration with the Sheriff's Department and emergency management. You know, while there was a drive-through event out in San Francisco over the weekend, there was not one in Solon, Iowa. Because we did a lot of discussion, we did a lot of planning, and we're thankful for that support. And I want to say thank you for everybody who came out to Solon Beef Days. So appreciate that. Also, I wanted to share that this is really unprecedented territory for the city of Solon because we're just beginning our first 5-year contract with the Johnson County Sheriff's Department. We've been on an annual contract for the past 28 years that I've been with the city of Solon, and so this is really groundbreaking for us. It's going to help us budget. It's going to help us really focus our resources, and we're very appreciative to have the opportunity to work with the Sheriff's Department and to share resources as city budgets are really challenged right now. So I wanted to just take this opportunity to just express our appreciation for the work that's happening in the county and the collaboration in the county. Thank you.
Thank you. Anybody else? Am I not seeing anybody? I'm missing a hand. Okay. All right. Next up, we have an update on individual disaster assistance programs. We've got, we have Jennifer Benson. Do I see her or I see Deb?
Jenny's here back.
Okay, excellent. All right, good deal. Oh, there you are. Oh, there you are. You're behind the superintendent. Okay.
She's hiding back
Yeah.
there.
Okay, so yes, disaster assistance programs. Presented by United Way of Johnson and Washington County and HACAP. So take it away. Let's hear it.
We do have a presentation that was failing to send, so we'll see if Thor is able to help us out. But we'll go ahead and get started without it.
Absolutely. My name is Debbie Ackerman. I am the Johnson County Director and the Director of Community Building and Engagement for HACAP. We're the Hawkeye Area Community Action Program. You want to introduce yourself?
I'm Emily Meister, and I'm the Director of Community Impact and Engagement with United Way.
So we're just going to talk to you about the disaster response in Johnson County and what we do. So we are both representing the Johnson County COAD. The COAD is Community Organizations Active in Disaster. I will warn you right now, there are a lot of acronyms in our presentation, and I will mess them up probably multiple times during this presentation, so forgive me for that. But again, we're here representing the COAD. It was established in 2008, and the role in the community is bringing agencies together to ensure readiness to meet needs in disaster events, whether it be fire, flood, tornado, any of those things where we need to come together to help our neighbors. We are a program that is headed by United Way, but again, it is a number of different community organizations coming together to ensure needs are met. United Way does hold the Community Disaster Relief Fund, which they like to keep at about $125,000 to meet needs of our community that aren't being met in different ways. Another big role of the COAD is volunteer management. We know that as Iowans, we like to help our neighbors when disaster strikes. And United Way is very good at helping mobilize and organize volunteers, and that is a big role that they play in this COAD as well. Our COAD has gone through some significant changes in the last year or so, and the folks at United Way, again, have really worked to make sure that it is organized and that we are able to meet a number of different needs. Our steering committee is made up of Emily and Nate Savage from Johnson County Public Health. Those folks are our co-chairs. I'm the secretary, which, you know, there's that. But then it's also made up of committee heads. We have, I apologize, our presentation would show you our committees. However, all of the committee chairs of our committees are, again, local agency leaders who know the landscape, who know the resources, and are able to help guide our committee to ensure, once again, that needs are met when disaster strikes. We also, on our steering committee, have several just advisory members who don't necessarily head up a committee, but who have expertise in a number of different areas, again, to be sure that needs are all met.
I'll continue with
Emily will tell you more about the committees.
Yeah, so I apologize for not having our visual. It would be a little easier to understand that way, but the file was too large and failed to send. But so as Debbie mentioned, we've really been doing a lot of work in the past year and a half to strengthen the COAD. We're seeing obviously a lot more disasters nationwide, also in our community. And we also know that some of our state and federal supports are a little bit less reliable and consistent as they used to be. In addition to that, and Debbie's going to talk about the grant assistance program here in a moment, but there's a threshold that either a fire or a disaster or anything like that in a community must meet in terms of dollars of damage before state or federal funds kick in. So there are a lot of instances where there's a significant event to us here locally, but it doesn't meet that threshold, and that means 100% of that response is up to our local community. Case in point, and what we'll talk about here in a little bit, is the fire that affected Coralville residents recently. So traditionally, like Debbie said, the COAD was established in 2008. Traditionally, it's been led and activated by United Way with coordination from other community partners. But it was kind of struggling to take hold and really have the kind of leadership that it needed for the past several years. Part of that is capacity. We all know for a disaster response, that's an extra on many of our jobs. So we've created a template, or not a structure, where that leadership can be shared and brings the right people to the table, not just in response, but in preparedness. So Debbie mentioned a little bit about that, what that structure looks like with our steering committee, which is made up myself, Johnson County Public Health, Debbie with HACAP, and our co-chairs of our committees. We have an unmet needs committee, which we are still looking for leadership on that one. We have a long-term recovery, which is co-chaired by Lynette Jacoby with Johnson County Social Services and Adrian Corbacus with Community. We have a training and preparedness committee that is led by our emergency management director, Dave Wilson, and then Travis Beckman. We have training and preparedness with Wendy Nolan from United Way and Nate Savage from Johnson County Public Health. And we have communications and public relations, public outreach, which is Ellie Moore with Community Foundation, and Michael Shaw with Neighborhood Centers. One thing that we realized in this most recent disaster is we were missing some key players at that activation stage on our steering committee, and we've already in the last 2 months since then worked to bring on community and reps of Shelter House so that the people we need to respond are there right from the beginning. So I think I'm probably covering what was on those slides that we spent today preparing for you.
Speak for yourself. I did them on Friday.
But that's the idea, right? If we want to respond effectively in a disaster, we do not have time to coordinate and build those relationships at that time. They need to already be existing. So we'll have co-ed quarterly meetings. Those are intended to be open to the entire public. Any organization, entity can join. If you're interested in joining that and you've not already, please let me know. There's no commitment at that portion for anything other than just attending those quarterly meetings, and it helps you get to know who's active in this space, what the needs are, and just get to know each other. When there is an event, then that's when we activate our steering committee and get all those folks at the table and figure out what the needs are for our community members that were effective, and start pulling in other agencies. So that's kind of the gist of a co-ed, right? We have emergency management, we have our fire departments, our police departments, those government entities that really are going to take the lead in that initial response. But they're going to be too busy to coordinate all the long-term recovery and community organizations that need to be pulled in to fully support people who are affected. So I'm going to pass it back off to Debbie so she can talk to you about the updates with the disaster assistance grant program. And then if we have time, I can give a little bit of an overview of what this looked like in this recent fire.
So as Emily mentioned, when a disaster occurs in the county, the threshold determines the response. COAD is always going to be activated. We're always going to take a look at the situation and ensure that needs are met for the residents who have been impacted. Depending on the level of disaster, whether it be a fire or a storm, depending on the amount of money, amount of damages that have occurred, that will then determine whether or not the governor declares the county or the region or whatever a disaster. My caveat here is that when we first planned this presentation and wanted to come, we wanted to talk about the Iowa Individual Assistance Grant Program, which is a program that provides up to $7,000 for disaster-related expenses for people who are living at 200% of the federal poverty line or below. It is a contract, and it is a program that Community Action across the state has administered for decades. We did just find out that our contract has been rescinded. The Department of Homeland Security believes that they are able to administer this program, and so HCAP will no longer be doing that at the local level. Again, it is a program that, for the most vulnerable people among us, provides that $7,000 for things like personal property, home repairs, roofs, shingles, mold mitigation, those things. A lot of times during an emergency, folks will lose power and lose their food, so we're able to provide food assistance, and then temporary housing as well. So hotel stays, deposits for new apartments, new places to live, all of those things. It, again, is a program that is now run completely through the Department of Homeland Security, at least starting August 31st. They have folks, when impacted by a disaster, have 45 days to apply for the program and then have additional time to get in all of their documents. We know that people, especially people who are marginalized and have some other barriers, that it can take a little while to get all of the necessary documents. So we work really closely with them, ensure that everything is in place, and then we're able to provide those monies to them, either reimbursing them for their food or for their repairs, or being able to pay those contractors directly from us. Those things, again, I'm not sure what it will look like moving forward, but those are the services that are provided through this program. This program also provides assistance to people who are over 200% of the federal poverty lines in the way of disaster case advocacy. That's a newer program, or newer part of the program. It is, again, it doesn't come with any grant funds, but it has someone who will help identify and access new resources, for those folks who are experiencing disaster, helps them develop a home repair or rebuild plan, creates a recovery plan with steps to reach their goals, and more, just depending on their needs post-disaster. The last time that we utilized this program in our region was for the tornado in Coralville in 2023. And that was a very successful program. We were able to help a large number of people with those expenses. Since 2019, let me look at my slide real quick. Emily, you've been locked out. But I want to say since 2019, there have been 5 activations of this program. I was right. 5 activations of this program, 270 applications received from Johnson County residents. 177 of those were approved, and just 1 disaster case advocacy application was received, again, because that's a newer program and one that hasn't really taken hold yet. I will say, just for comparison, we are working with Scott County residents right now for the flooding that recently occurred in Davenport, and we've received 220 applications just for that disaster alone. So again, you can really see, depending on the area or the number of people affected, this program really works to help folks. And really is something that our community really needs. So I'm hopeful that this program will continue in the way that it deserves as we move forward. That's what I'll say about that.
So, are there any questions about what we've shared so far? Is this a question and answer type of situation? Okay.
It is now.
It is now. Okay, it is. We're changing the rules. Well, we can answer questions about the program or the changes. I can also spend a little time talking about the specific fire response if there's time on the agenda for that. Yeah. Okay, so the event happened April 9th. So it's already several months back. It was a 12-unit apartment complex on Boston Way in Coralville, and it was 12 households and 26 individuals. And the immediate response, like I mentioned earlier, was led by the Coralville Fire Department and then Johnson County Emergency Management. That initial immediate on-site response is really left to those professionals, and we do encourage community partners, if not explicitly invited, to not try to be there on the scene. But we did have a great presence by community mobile crisis as people were actively being evacuated just to be supported there. The first step in that situation is, of course, to account for everyone's safety and get to a safe location. Traditionally, in an instance like this, the Red Cross, everyone's familiar with the Red Cross, they'll step in fires and emergencies like this. Their preferred method for anything over really a single household event is going to be a general population shelter or a mass shelter. From our community's perspective, just knowing the kind of care delivery and what we expect in these situations, we've done it a little bit differently in the last several instances. Instead of opening a mass pop shelter, United Way works with emergency management to find alternative accommodations, usually in the form of a hotel room, where we can get everybody in the same place and be able to provide coordinated resources on site, but a little bit more comfortable of an environment for someone who's just experienced this trauma. It is more expensive, of course, locally. I think our United Way spent just under $10,000 from our disaster relief fund. That is what it's for, to be able to house those individuals, some for a couple of days, some for several weeks. But the Red Cross was there to still do some of that case management and meals. One of the challenges is if we're not following that exact model, it makes it harder for them to deliver their whole model. So we did struggle a little bit with meal delivery and case management. And that we found is actually one of our biggest challenges in this response was case management. We had a really wide variety of individuals that were affected. We had University of Iowa students, a single mom, University of Iowa students, elderly couple, immigrant populations, non-speaking. It was the whole breadth of our community represented right there in that 12-unit apartment complex, which meant that the response and the recovery is a little bit more complicated and needs to be individualized as well. And at the time, we didn't really, our co-ed, we were working on this structure, we're working on what our committees and our activation protocol look like, which is not yet finalized. So we realized right away that our gap was case management. We didn't have an existing contract with an organization here locally that could provide that ongoing support for folks. Housing being the number one concern. We live in Iowa City area, and affordable housing is always a big concern when you need affordable housing right now. And we're talking just under $1,000. So not really, really cheap rent, but that's hard to find in this area. We also struggle with the leasing cycle. August 1 to July 30th is when many of our leases turn over. So when you need apartments right now in May, that's really, really challenging. We did, after a few days, we were able to develop a contract and an MOU with the shelter house, which will allow them, for this case and in future instances like this, to be able to prioritize individuals who have been affected by a disaster and work with them immediately through their coordinated reentry and rapid rehousing program. We didn't have that before. Our co-ed steering committee, which was made up of all the individuals I mentioned earlier, I believe none of whom on the list, apart from Lynette, are experienced caseworkers, but we feel that, maybe Debbie. We filled that gap. We made a schedule so that amongst the 10 of us, we had somebody out at the hotel at all times, even during the weekends. So if people had questions or concerns, they had somebody to go to. We did a lot of hands-on with our steering committee. In the future, that's not how we intend for it to work moving forward. We have this partnership. We're going to continue to create partnerships with other agencies that can provide that service so that our co-ed steering committee can really take a little bit of a step back and work more on the pulling in other community resources and things like that. I think out of the 12 households that were affected, I know 2 have relocated to Cedar Rapids just because of not being able to find affordable housing in this area. Some are temporarily still housed in a hotel of their own choosing and covered by insurance because they're transitioning to home ownership. So everybody now is in some form of stable, long-term or temporary housing of their choosing. So we consider that a success. Despite some of the gaps that we had, we got a lot of really positive feedback from those residents that they felt very supported and did feel that they had somebody to go to, even if we were filling the gaps. I think that's it. I didn't look at my presentation once.
We didn't either.
Because barely not.
Questions?
Mayor Foster,
Yes.
could you talk a little bit about the interaction you're having with the school district if there are students involved in a family that's experiencing a disaster?
Sure. Right now, we do not have that line of communication open, though we have had 2 individuals from the school district join our co-ed in the last 2 meetings, and so that is one of the areas we've identified as a need to strengthen.
Thank you.
Other questions or thoughts? Okay.
Thank
All right, thank you.
Thank
so
you.
much. A lot of great information there. Appreciate all the work that you do. Okay. Next up, we have a discussion on current crisis response programs and exploration of opportunities to further collaborate. So this was placed on the agenda by our friends from Iowa City. So take it away.
I'll just...
Oh,
Thank you, Mayor. Yeah.
Okay.
I'll jump in. The Iowa City Council recently had a presentation from our police chief, Dustin Liston, and Sarah Nelson, who's the executive director of Community Crisis Services, talking about the co-responder and liaison program that we have in Iowa City. And I know at a recent county the Criminal Justice Coordinating Committee meeting, there was a presentation from Sheriff Kunkel's staff, Kiana Pope, who is a liaison for mental and behavioral health calls as well. And I know that Supervisor Remington has been participating in a national cohort talking about different ways to address community response. And at the JEC, where Mayor Hoffman is the chair and I'm currently the vice chair, we've been talking about how can we get even more sophisticated and better match response to calls. So for those of you who've been in your positions for more than a few years, you probably recall the conversations around when 988 rolled out and what 988 provides for people who are in crisis, and the fact that Johnson County was a pilot county for having calls that come into 911 be able to have a handoff to 988 for those mental and behavioral health calls. Also aware of Johnson County Ambulance Services Integrated Mobile Health Program, and I know that Iowa City Fire Chief Scott Lyon has been talking with Director Johnson about different ways of responding to different kinds of calls. So Councilor Moe and I said, let's try and get everyone in the same room to actually talk about this, at least on some introductory level. So I think our hope for today was to have those individuals who we tapped to come and speak just a few minutes to make sure everyone here knows what those response options currently are and how those organizations are working together. I think all of us have seen this is the political moment to really be collaborating and to find those efficiencies among our different jurisdictions and departments. And so there's a whole lot going on, and we're just hoping to kind of have an introduction for everyone as to what the programs are. So I know those of you who said you were willing to provide a couple of minutes, maybe if you could go up to the microphone. We could start with Chief Lyon, you're closest, or Fiona, you were starting to get up.
Let's have Chief Lyon in here next. Fiona Johnson, Johnson County Ambulance Director. We launched a community paramedic, which is also known as a mobile integrated healthcare program, part-time in February of 2024. That became a full-time program in July of 24. We have had great success with this, and really there are many different benefits of the program. Some of the key points are to improve access to health care to underserved individuals in our community, to reduce cost, and to improve patient outcomes. So those are the three main focus points. The way that we're achieving those kind of goals are we've got a community paramedic that is going out and responding to individuals in their homes and helping connect them to social services, to do some basic non-emergency medical support. That might be medication management, that might be connecting somebody to a primary care physician who might not have historically ever had one. And then really also kind of reducing that cost, because ultimately they're now reducing the 911 activation because they're not necessarily needing that ambulance or fire or law, or reducing cost in the emergency department setting because they're not automatically just calling 911, having an ambulance respond, automatically transporting the patient to the ER. So this individual is collaborating with our community partners. Fire had given us some high utilizers. We have our own high utilizers. So really kind of digging in to determine what the root cause of the need for emergency services might be. So it might be somebody really just doesn't have the ability to stay on top of their medications. So one of the kind of smaller little success stories that our community paramedic had was an individual that just really got paired with Towncrest. They were able to get connected to those pre-filled med packs, and that simple change of having an individual that went to the home, saw the issue with all the different medications, spent the couple of hours with them and made that connection, and that instantly reduced the 911 access for that, response need for that individual. So little small steps, but just having an individual that can take the time to really kind of find what that root cause of the 911 activation is. Mike is our community paramedic, Mike Mothershed. He's on vacation with this week, so it's good for him to have a little break. So sorry that he couldn't be here, but we would love to present to this group to kind of show our findings and some of our other success stories. But as I said, he's collaborating with our community partners, working with the Johnson County Sheriff's Department, looking at a long-term injectable program to help individuals that are maybe getting released from jail that are maybe prone to have a reincarceration due to a lack of compliance with their monthly injections for psych medications. So if we can get this medication to the individuals before they get into crisis, before they then have to interact with law enforcement, then we've solved a problem before it's kind of started again. In addition to our community partners, Mike also is partnering with University of Iowa Population Health. They're looking at their high utilizers. We're looking for community partners to help find a funding mechanism, because right now it's the Board of Supervisors trusting in the concept and the overarching goal of hoping to reduce the cost, but we do need to find those other funding mechanisms. So that is kind of the nickel tour of our program. If our community partners want to jump in, and I'm happy to answer any questions that you might have as well.
Good afternoon, everyone. Scott Lyon, Fire Chief, City of Iowa City. My role in the community paramedicine or mobile integrated health is really, at this point, a supportive role of what's going on with Johnson County Ambulance. I can personally attest to the difference that they are making on a daily basis out in our community. We have identified and collaborated on shared needs. Recently, we hosted a remote meeting with some of my peers back in central Iowa, looking at innovative strategies, be it call triage and diversion at the dispatch center. But ultimately, where we're at right now is really in the fact-finding stages of how we can best support Johnson County Ambulance to fulfill the mission. I think there's some real low-hanging fruit out there that we can go after. To reiterate what Fiona was saying, there is a financial component that we have to address to make this be successful. So I think it probably needs to be on the radar as we continue to collaborate amongst agencies, that we can certainly make a difference, but there is certainly a cost associated with it. Okay.
One quick question for either of you.
Sure.
How about how many high utilization people are you guys focused on that one paramedicine that Mike can actually address? Like, what's the population that he can serve?
Well, it's hard. He is one individual.
Mm-hmm.
He probably has 40 clients on his docket right now.
Okay.
And the university could give him hundreds.
Okay.
So and we've got, obviously, our number continues to grow, and Fire's, Fire had one that was an individual that was continually falling. And so for us, so they just get called for the lift assist. We wouldn't necessarily get activated, and so we didn't even know that individual was a high utilizer. But for Mike to be able to go out and do an in-home fall risk assessment for this individual to figure out, okay, what is the problem? Now can we get some of these safety supports put into place, and then reduce the call activation from that perspective. So we need more than one community paramedic. We need multiple, and ultimately the dream is for this to be a county-wide collaboration. The partnership with the sheriff's department, to also pair with the community liaisons. To have Mike, sometimes he'll respond with a social worker, sometimes respond with law enforcement, sometimes respond with fire. This is intended to be a big community collaborative effort.
Well said.
Is there any, you want to say a few words?
Hi, my name is Adjourn. I'm here on behalf of Community Crisis Services, filling in for Sarah Nelson today. So just talking a little bit about the different crisis response services that are available to support individuals that are having an emotional or behavioral health crisis. So we do answer the 988 line statewide with one other center here. 988, 3-digit number. Anybody can get connected to a trained crisis counselor. Those counselors on the phone are able to stabilize over 95% of individuals that call 988 without necessarily needing to refer them to a higher level of care. Most of the referrals that happen on our 988 line are to other points along the crisis continuum to assist individuals. So we do a lot of referrals to mobile crisis services, a lot of information about access centers, CCBHCs, and now also with our new Iowa Behavioral Health realignment, we'll also be making referrals to system navigators for people to be able to connect with services in their local area. So 988 we answer statewide, so here in Johnson County, but also all of the counties across Iowa. Last year, between all of our crisis helpline services, we answered over just close to 100,000 contacts, with a quarter of those being Iowa 988 specifically. 988. So then our next kind of level of service that we provide here in Johnson County is our mobile crisis response services. So these are 2 counselors who are trained in crisis counseling and mental health support. There's different pathways that you can go through to become a crisis counselor. We are accredited through the state. So the state has accreditation standards for what constitutes the proper education and training to be a crisis counselor. So we follow those accreditation standards. Our teams run 24/7, 365 in teams of 2. Individuals can access mobile crisis by calling 988 or also the old Your Life Iowa line. Both of those will route you to dispatch, where a few questions will be asked and then counselors will be dispatched to whatever location the individual is at. When I say we've been to just about every location possible, we mean it. We respond to schools, we respond to hospitals, we respond to offices, we respond to doctors' offices. I have done a mobile crisis dispatch in a cornfield before because that was where the person wanted to meet with us. And so when we say mobile, we mean mobile. We are going to go, we're going to meet with people in their private residences, wherever somebody's experiencing a crisis, we'll go there and try to work with that individual to de-escalate. Some of the things that happen on a mobile crisis call, we do universal screening for suicide ideation. So every contact, we're asking people about suicide, and if they are experiencing suicide ideation, we do safety planning with every single person that we work with. Safety planning is one of the evidence-based models for reducing people's ability to act on suicide. It's been shown to be effective in keeping people alive, and so that's why we follow that practice. We also see a lot of individuals that are not thinking about suicide, but they may have other things going on in their life that are feeling very overwhelming for them. So for some folks, that's an increase in mental health symptoms. Maybe they're experiencing mental health symptoms for the first time. Maybe they've lost a job or have some personal situation going on that's causing a lot of overwhelm and anxiety. We see a lot of people with co-occurring disorders where they're struggling with substance use and mental health and maybe difficult life circumstances altogether. We spend a lot of time working with individuals that are maybe experiencing acute grief or loss. And then we also do partner with some of our local law enforcement entities to do things like death notifications or things like that to be available to individuals kind of at their most difficult time. We consider ourselves to be a very low barrier service. And so really there's only a couple things that we need to know about people before we're able to dispatch. Number one, we send 2 counselors. We aren't law enforcement, and so we want to make sure that the scene is safe for our counselors to respond to. If there are concerns about the scene being safe for our counselors, a lot of times we will send one of our law enforcement liaisons instead who co-respond with law enforcement, or we will co-respond with law enforcement with mobile crisis as well. We also just want a little bit of demographic information from people about what's going on so that we can be supportive and help them. Our average response time in the Iowa City Coralville area is just a little over 20 minutes. So from the time somebody calls till the time that counselors show up on their door, just a little bit over 20 minutes. And so we're able to get there pretty quickly to connect with individuals when they need us. 95% of individuals that we see in mobile crisis are stabilized in their home, in the community, without needing a higher level of care. The remaining 5% go to crisis stabilization beds or the hospital, depending on the needs of the individual that we're serving. Yeah, we serve all ages. I think the youngest that we've seen is around 3. Oldest was in their 90s. So again, we really try to be very low barrier and holistic. We are a point in time service, so we are trying to stabilize that crisis now, bring the escalation down to a level that feels manageable for that individual in the community. The next day, our follow-up team is following up with that individual to connect them to longer-term resources and supports based on what was going on for them in that initial crisis. We also have law enforcement liaisons embedded with ICPD. We cover both first shift and second shift. It is a very, very busy program. And so they're able to respond to some of those more high acuity calls that come in. They also are able to do committals. So if we identify an individual in the community who maybe isn't aware that they're sick, needs that level of support to stay safe, our law enforcement liaisons will work with their families, work with the people around them, work with law enforcement to get that committal placed, to get that person the support and service that they need. We also are the triage counselors at GuideLink Center. So whenever somebody comes to GuideLink Center, we're the first face that they're going to see and meet with. Last year, we saw just around 2,400 people in GuideLink. The majority of individuals that we see either go to sobering, detox, or crisis stabilization. And then another good chunk of individuals just meet with our triage counselor and then discharge back to the community with resources and support in place. I forgot to mention that all of our mobile crisis teams can do direct admits into the crisis stabilization beds, both here in Johnson County, but also in Lynn County. So if we come across an individual that needs a crisis stabilization bed and there's nothing available at the GuideLink Center, we're able to transport them up to Lynn County. And so our mobile crisis team does provide transportation for individuals as well. I'm trying to think what other, and then our last service that we have is Healing Prairie Farm. So this is a youth crisis stabilization program. It's a program designed for youth ages 12 to 17 who are experiencing some sort of an emotional crisis here. We can serve youth all across the state of Iowa. Most of them come from eastern Iowa. And it's a 5 to 7 day stay out on our farm. If anybody's familiar with the old Kinder Farm property, that's the property where this is housed now. And so we utilized a care farm model, which really integrates nature-based intervention along with a lot of emotional support from our staff. So the model for that program is youth meet with a mental health provider. They dictate the treatment plan while they're out there. The goal is to provide, some structured support for the youth, also to get them connected to some of those longer-term community services that are going to help them once they discharge. We do a lot of coordination with the schools as well. And then they're able to access those services while they're out there. They check in with a mental health provider every day, and then we're staffed 24/7, and those services run 24/7, 365 as well. We have 8 beds available for crisis stabilization and then 4 beds available for youth shelter under our RIE program, which is a federal program that gives 21 days of shelter to youth who are experiencing homelessness. The goal of that program is a little different than our crisis stabilization in that we're looking for long-term housing and connection to some of the life skills and supports that youth are going to need. Sorry, that was a lot of information, so if y'all have questions, please let me know.
Can you talk a little bit more about the coordination with the schools?
Coordination with the schools, sure. So we coordinate with the schools both for our mobile crisis program. We have a dedicated youth mobile crisis coordinator. Her name's Kimmy. She works very, very closely with all of the different schools in Johnson County. It is not uncommon for us to dispatch to schools on a pretty regular basis to support the youth that are there that are experiencing some sort of an emotional or behavioral health crisis. And then at the farm as well, we want to keep that line of communication open with the schools so that when they're transitioning back into school, we have a good plan in place to help support them during that transition and to support the school during that transition, because there are often times, if educators are aware that a youth was out of school for a behavioral health crisis or suicide ideation or things like that, that they can be a little bit nervous about, like, how do we integrate safely? How do I not push too hard? How do I make sure that I'm helping this person integrate back in after that placement?
But instruction isn't taking place?
No. I should clarify this. If they're in crisis stabilization, there is no instruction taking place. If they're in our shelter, one of the requirements of that is for them to engage either in their home school if they're not from this area, or we work with the school district for them to continue to attend classes if they're in shelter. But it's on a very case-by-case basis.
Is this all schools in Johnson County, or?
Mm-hmm. Yep, all schools in Johnson County. I don't think there's a school in Johnson County we haven't gone to, so.
And Adrian, I know you just lost a big contract for your LGBTQ.
We did.
988. And can you tell me, 100,000 with the response that you took in, about how many of that was your LGBTQ?
Around 70,000.
I think that it's super important that people understand that people that are in your organization have the same training. That number may be, the way that it's accessed will be different, but I really think that we're trying to get the word out that, like, no matter who you are,
yes,
please do use 988.
Absolutely.
To have 70,000 of the 100,000. Sarah Nelson told me that last week, and it just knocked me down. Like, I just cannot believe that this is what we've lost. But thank you for what you're doing, and just keep trying to get the word out about 988.
Yeah, absolutely. 988 still exists. It's here for everybody. It's still the same counselors answering those lines. And so, you know, even though we lost one of our specialized lines that was very needed, we're still here. We're still answering.
Thank you.
Any other questions?
Okay. Anyone else?
I think my name is Dustin Liston. I'm the Iowa City Chief of Police. I think it's a good segue because Adrian talked about our partnership. In 2021, the Iowa City Police Department partnered with Community to provide a mental health liaison. So it's their employee that works out of the Iowa City Police Department. In 2023, we added another position, so to give us about 15 hours of coverage a day, 5 days a week. In 2024, we transitioned one of those liaisons into what we call a co-responder position. So that person is partnered up with a police officer who's wearing a uniform similar to what I'm wearing now, and they respond to calls in the field. They're just like regular partners, police partners, but they can jump more calls. So we noticed that this particular unit responds to about twice as many calls as our station-based mental health liaison. So they're averaging about 100 calls per month for our co-responder, where our station-based liaison is between 30 and 50. So we're getting a lot more coverage. And what they do, they have a lot more time. They can sit down with the person and make sure they're connected to the services that a regular police officer, even though they might be familiar with the services, they don't really have enough time to connect them to those services. What our station-based mental health liaison will do is a lot more follow-up work. They'll also go out in the field and respond to calls where they feel it's necessary, but they can also spend their time making phone calls and making sure people are connected to the services that they need. So I know our city council had a goal of providing 24/7 coverage within the next few years, and we're getting closer, and we'll evaluate, whether we need overnight coverage or not, but my goal is to get coverage 7 days a week. Again, we have coverage 5 days a week, 15 hours a day, and they're plenty busy. They see a lot of people, and they're providing a lot of value. One of the things I'm looking forward to looking at with our new data analyst is calls, how that impacts calls for service after someone has been plugged in with the mental health liaison, if it increases or decreases. We haven't been doing it long enough really to have a good feel for it, but I know it's added a ton of value. The people who oftentimes we have repeat callers because they're happy about the service. They found someone that they can trust, that they feel like understands their issues and they're familiar with, so they'll call, which is fine. If it doesn't reduce our calls for service, that's fine, as long as the people are getting the services that they need. And any questions that you all have? Go ahead.
Is the training of your liaisons primarily or initially law enforcement or is it as a mental health care, behavioral health care provider?
Right, that's a great question. No, they come from community, so they're social workers and have a mental health background. They don't have any law enforcement experience, so and they don't become police officers either. They're still social workers, and we do have a police officer for the co-responder that responds with them just to make sure the scene is safe, and then the mental health professional will step forward and take it over from there. And that's what we decided to go with, a little bit softer of a uniform, because we understand sometimes, the police officer's uniform and all their equipment can be a little bit triggering for some people.
They go into the schools, you say?
No, well, if called, they will go into the schools, but it's wherever, yep, they listen to the radio and try to pick out what calls seem to have some sort of mental health component to them, which, to be honest, is most of them. So they're pretty busy.
Do you have much overlap with the community paramedic program as far as the people that you're seeing, or do you have, I know that there's privacy constraints for sharing that information. Can you talk a little bit about that?
What rang a bell is our frequent users. Yeah. So we have a similar thing with the mental health side, and some of those certainly do overlap.
All right, anyone
2-3 minutes? Easy. It's not an election year for me, so no problem. Brad Kunkel, County Sheriff. So we have a very similar program to what Iowa City has with a mental health liaison that works with law enforcement. We do it slightly different. It's an employee of the sheriff's office who then we share that person and the cost with the city of North Liberty and the city of Coralville. It's proven to be a real effective way of doing business for everybody, and the idea behind it is, as a standalone law enforcement agency, we police about 35,000 people in rural Johnson County. It's really not enough of a population or a call base to sustain one person dedicated to just that amount of people. And I think it's safe to say the same concept can be applied to the city of North Liberty, city of Coralville. Independently, we're not big enough to require an FTE and pay for it Monday through Friday in each. But working together and combining the calls and what we do certainly makes a lot more sense. So the cost is shared 3 ways currently. And then to what Councilor Burgess mentioned at the last Criminal Justice Coordinating Committee meeting, we actually had the discussion about we're at a point we need to add a second one. So right now, our liaison works day shift, basically 9 till 6:30 p.m. And that gap we're really starting to see is we do need somebody to cover early evening and into the evening hours, maybe till 9 or 10 o'clock. But we still need some of that overlap yet with the afternoon shift. So that's something we'll probably have in the budget next year and continue trying to work with our partners at Coralville and North Liberty. But works really well. She does a great job. We're very fortunate to be able to provide the service. Any questions? Yes, ma'am.
Am I allowed to ask a question?
Yeah, go for it.
Can you talk about the point that for mobile crisis, which I love, it's a wonderful service, I want to say this, but if I were a family member calling for my son in a mental health crisis, unless he agrees, I can't get mobile crisis to come respond. Is there always going to be a need for 911 for people that are dealing with somebody who will not voluntarily agree for a mobile crisis response?
Oh, absolutely. You'll never replace that need for 911 or a law enforcement response in a lot of these situations. And you're right. The thing we have to remember about a lot of these services is the voluntary component of it. And GuideLink's a good example. You know, GuideLink's a healthcare facility, and admission and entry and the trip to GuideLink to GuideLink is voluntary. You know, we can't say, all right, Megan, either you're close. You know, we can't just say get in the car, you're going, and take you there as like a, you know, alternative to jail, if you will. The decision go there is going to be yours. We can certainly do everything we can to encourage you and talk you into, but at the end of the day, it's voluntary. So there are those instances where arrest is the appropriate response for the situation, or sometimes it's the only option we have, maybe because GuideLink is not something they're interested in. For a public intox would be a perfect example. But to your point again, most of these services also are voluntary. And we, in law enforcement, we're also the only, you know, I would say piece of the puzzle that we can't say no. We are the ones that will still always respond 24/7, 365. And I'll say it, nobody else, I mean, we do an excellent job at what we do. We always have. We train a lot for these circumstances and situations. It's important to us, and I could give you an example of something last night that was an exceptional outcome for a situation that we had. So we're really good at what we do, and I'm very proud of the work that everybody does.
Okay. Questions or speakers?
So my name is Tom Jones. I'm the director of the Joint Emergency Communications Center here for Johnson County. One of the unique things about our entity is we represent all agencies and everybody in this, all cities and surrounding communities in the county. When you call 911, we're the center that's taking your call and dispatching those resources. When it comes from some of the things you've heard today, and we talked about 988 a little bit, you heard a little bit about 911. From our standpoint, we work together with 988. When we receive our dispatchers have a flow chart that has been approved here internally amongst our law enforcement agencies. And so we have a set of questions that we ask callers when they call in. Based on answers to those questions, it determines if it's a law enforcement or public safety response, or if that call would be transferred to 988 for 988 to handle that call. And then in some cases, those calls could turn, and 988 could transfer that call back to 911. There are calls that start at 988 that also then come to 911. So it's a complex process, and to try to go over it here in a few quick minutes, I'm doing my best, but primarily we go off of it's flow chart based. And people sometimes ask, how many calls are you forwarding to 988, or how many calls are coming to you from 988? 988 calls that come to us that should go to 988, they're very low. There's been only 3 in the last year and a half. Only one was a real transfer that we made. So locally, what we're finding here at the communication center level at 911, which is the first call in the event of emergency or crisis, is that the numbers being used appropriately. We're finding that when people are dialing 911, it's because there is that immediate self-harm to themselves or harm to others. And in that case, in this flow chart, that requires an immediate law enforcement or public safety response to that situation. In the event that there's not, and someone calls, because I'll give you an example, most of the time when we receive a call, and I'll just use suicidal because those are calls that unfortunately we get quite a bit of. Those folks, when they're calling 911 and they're going through our questioning, they're not thinking about it 30 days from now. They're not thinking about it 2 weeks from now, or they just didn't lose their job, and they said, hey, if things don't get better for me, I might think about hurting myself or harming someone else. When those calls are coming into us, they're actively contemplating harming themselves now, or the threat is there, or they have the ability to harm themselves or someone else right then. Those are the type of calls then that we are transferring out to the law enforcement responders that you heard from speak today. You heard about some of the things they're doing. They have the co-responders and things like that in their entities. For us, we would dispatch or notify mobile crisis at their request. One of the things that's been talked about recently with some small subgroups with some of you folks here even today, or how do we dispatch mobile crisis sooner? And as of today, they're dispatched at the request of the law enforcement responder. We give them as much details as we can. One thing that we're known about here is our jobs, we're sending people to calls with about very little information that we can try to ascertain in a very short, quick amount of time. So sometimes that information, it takes a few minutes to get that additional information for them to make that determination to say, hey, can you dispatch mobile crisis with us, have them stage, and then once the scene or situation is declared safe, then mobile crisis would come in and assist them. So as we look ahead to the future, sorry I'm going fast for time, but as we look to the future on our side of things, in the 911 side, is there's been discussion and there's been things around the country where people are they're integrating some of these same folks that you're hearing from today, where community has had these co-responders with them, integrating these counselors in the communications center right where the call happens immediately before it's dispatched. Some of the things that we have to think about here is, in order to make that effective and efficient, is the number of calls we're getting, time of day it's occurring. Are we getting enough to start incorporating someone in with us? Or is the flow chart, the process, the training we have, is it sufficient today to continue on? Because if you do bring one of those individuals in, if you bring a counselor in, obviously there will be a cost to that, and we want to make sure it's cost effective for them to be there. If we're not receiving that volume of calls, and as I stated earlier, right now it's been about 3 this last year that even got coded that way, one actually being an actual transfer. Then we have to look at some of the other areas we're doing, which would be maybe a suicidal caller that is an active threat. What benefit could they provide to us in this situation and to de-escalate it? before someone gets on scene. So there's a lot of things in there I think that we're going to continue to work on in the future. One thing about being the countywide 911 center that represents all the entities in Johnson County is we try to keep our procedures down to one way, because if you can imagine, I have 5 full-time law enforcement agencies. I've got over 15 fire departments and a countywide ambulance service. If each one did their own thing to try to organize that, we would be making more mistakes, or we would delay, dispatch times. If we have to think about, wait a minute, Iowa City is a full-time career department, they get dispatched this way, but this agency is volunteer, they don't. So we try to write everything standardized where each of these disciplines all have come to agreement on the same way that they're dispatched consistently. And so we dispatch these things based off of their individual operating response policy. So I don't dictate to them how they respond in these cases. We work together collaboratively with all the law enforcement partners, the ones you've heard from that are here today. They're all part of that, and then we develop our policies and procedures based on their responses. So as you talk about this going forward, those are some things to kind of consider when it involves us. So I tried to go quickly. It's probably the quickest I've ever spoken to. I know they're already giving me a hard time saying I should go last. So. All right.
Okay.
Thank you.
Thank you. Okay. Any other discussion or questions or thoughts before we move on to the next agenda item? Okay. Next up, we have a update on measles. Isn't that fun? Because here we are. Yeah.
Good afternoon. Sam Jarvis, Johnson County Public Health. Appreciate the time slot today just to provide a quick update on measles. I'm sure a lot of folks have seen that in the news here locally and then certainly nationwide. So I'll just give a little bit of background of where we're at and kind of what's going on in our community. As most folks saw, sometime early June, mid-June, we had announced our case in Johnson County, the 3rd case for the state of Iowa was of measles. And our team quickly responded with the state health department and our healthcare partners to investigate that case and collect those contacts so we could establish, our usual process for contact tracing that most folks are probably well aware of at this point. Since then, in mid-July, just recently, the state announced their 7th case. And what's, I'll say, unfortunate about this is that what they're referring to as is locally acquired. And so what that means is that through their investigation, through our support, through the support of other public health agencies and healthcare partners, at this point in time, there's no link to that case to other cases. And so it's unfortunate, and I know that our team and the state team has really worked hard to try to track that back to maybe potentially our initial case, our 3rd case that we had here in Johnson County. But at this point in time, there's not a link. And so because of that, you've probably seen some of our information that we shared recently where there's a posture change for vaccine recommendations. And so I know previously we've been talking about an early 2nd dose, but what folks have probably saw or the difference of just this past week is what we're referring to as dose 0. And so really this is providing vaccination to infants 6 months to 11 months to provide the extra protection. So to clarify, the reason why they call it dose 0 is because it doesn't count towards the usual vaccine series that you get for school and daycare and things like that. So we're doing a lot of education around that so folks are aware. But what we want to be sure is that folks that this applies to, that they have that information so they can have that conversation with their pediatrician going forward. So while it's unfortunate, it is certainly not something that is unimaginable given what we've seen across the nation. I think as of date, the U.S. has seen roughly about 1,300 cases of measles reported. I will say, though, with confidence, and we're fortunate to have this line of communication with the state and federal partners still, given the chaos that we're seeing now, is that a good majority of those cases, roughly 92%, are from unvaccinated individuals. So this outbreak that we're seeing in the U.S. is still driven by folks who chose not to get vaccinated or, for whatever the case, cannot get vaccinated, either by age or medical condition. So it's encouraging to know that the vaccine is still effective, and so we're answering a lot of those questions. We've got a couple FAQs that are circulating right now, and so appreciate everyone's support in making sure that that correct information gets to folks, because we are already seeing a lot of misinformation, doing our best to tamp that down as much as possible. As you all know, that is very tough nowadays, so appreciate that support. So Having said that, those are the brief updates, but I'm happy to answer any questions or take those back to our team.
Are you seeing an increase in parents that are interested in vaccinating their kids?
We have, and so I don't have those rough numbers, but very encouragingly, anecdotally, the state health department has told us that since, we'll say, about a couple months ago of us launching our encouragement of the early second dose and now the 0 dose strategy, that they've seen a noticeable uptick in vaccinations in our area. We've asked to get that number just to kind of make everyone aware, but that's encouraging to hear, that information coming from ourselves, our healthcare partners, is getting out there. I know Deb Vandergas, our child care nurse consultant, is making sure that that gets to daycare so it can get into parents' hands too. So it's kind of that full court press of all of our partners that we can to get that information out there. So,
what's the child and adolescent full vaccination rate? Do you know that off the top of your head? Or
oh, the percentage?
Yeah.
Oh boy, I should have looked that up before I came. I apologize. It's pretty high. I think overall, for the most part, we're sitting somewhere high 80s, 90s in our area. So we've got a pretty good rate. We'd love to see it higher, obviously, especially for a lot of other vaccines. But even if it starts to dip down lower and lower, right, that's just more instances where it could potentially spread to other non-vaccinated persons. So
it will still remain the 21-day quarantine for the
Yeah.
foreseeable future, or do you see
Yes.
anybody stepping in and saying, "Hey, we need to lower that"?
Oh, I see what you're saying. I thought you were going to go with the 28-day question. I was going to be able to clarify that.
Just going with the direction that we went over the past 5 years.
Yep. Yeah. So far, I don't believe that there's going to be any change to looking at lowering the 21 days. And then for the most part, I think, I'll say confidently, folks are probably hearing that and thinking the day that you are told or found out, but likely there's been some time that's passed because you've either had symptoms, tested, et cetera, from the person testing positive and exposing yourself. So
So is it from exposure, if you can determine that, or from the onset of symptoms?
let me clarify. So for the quarantine, it'd be 21 dadays from your last exposure. Sorry, I probably didn't phrase that correctly the first time. For a person, let's say a public exposure in a place. It's difficult, right? A lot of folks probably saw our public exposure notice, the 3 locations and everything, and saw the timeframes. There's a good chance that someone could have been in those places and not been exposed. I will say, though, because of going through that process and having roughly about 200 some contacts from that point, we didn't have any other cases from public exposure. So again, it's good to know that in large area spaces, maybe less risk, but still indoor spaces, right? We've had this conversation with other respiratory viruses as well. So,
What's the timing between exposure and the onset of symptoms?
somewhere between, I want to say, 7 to 12 days, roughly. Yeah. When we start to put timelines together, it can get pretty difficult for folks, and so it's really helpful to have folks kind of jog their memory if we're doing that contact tracing with them. I know our team is well versed in kind of those kind of different joggers to try to track that down, but we're already fighting time when someone is exposed, starts to get ill, and thinks, I should hopefully call before they go to the clinic and get tested. And then that test has to get ran at the lab, and then that lab has to report to us. So we already start to lose time on that whole process, which I know most folks are familiar with.
Hey, Sam. Sorry if I missed this, and you addressed it in some communications or otherwise, but I know you talked about dose 0, but heard some things anecdotally about adults, and obviously we're thinking about all the adults that are going to come back along with kids and being able to make sure we have enough staff members. Is there any change in recommendations for adults and vaccinations, or anything you'd feel confident with us putting out to staff about, hey, you may want to check your status, or anything more specific we can provide than that?
Yeah, absolutely. So at this time, there's been no change to telling adults to go get a booster, and so that's good news. I think to your point though of things that could go out to folks, I'll say from a risk assessment side, our team, when we get a positive case and we're looking at the contacts to make sure and assess their risk, we're looking at vaccination status. So folks had that on file. That helps out a lot, especially when it's in the state registry system. Unfortunately, right, there's a lot of folks that may not apply. They probably got vaccinated at some point in time, but maybe their records aren't in the state system. and that's understandable. A lot of times our team will walk through, do you know the clinic as a kid that you went to get those records? By chance, does a family member have those records? There's an option to get your titer as well too. So, but having those records of that status of immunity is really important in terms of us kind of working through our workflow and process to establish risk for so many folks. As you can imagine, when it's a public exposure, 10, 100, 1,000 persons, it kind of exponentially increases the amount of contact that we would have to make. At some point, if it's tens of thousands, 20,000s, et cetera, we'll have to continue to kind of work through with our partners and look at what that public notice is and kind of what the direction it asks people to do. So.
Yeah.
Oh, so if you have a 6-year-old who his parents decided to get them vaccinated for the first time, the second dose, is that 28 days later then?
It is, yep.
Okay,
Yeah.
all right. And then for the dose 0, if you have a 6-month-old who gets the dose 0, when do they get dose 1? Is that at 15 months with a regular vaccination schedule, or when?
So long as they're spaced out at least 28 days, but let me double check, but I want to say that if, let's say you do the dose 0 strategy, you would likely get your next vaccination at your 1 year.
At your 1 year, okay. All right, thank you.
If someone came into a building and it has a shared ventilation system, and they're in that building the entire day, so just, whether it's hospital, school, building like this, library, is everybody in the building that's on that shared ventilation, that shared HVAC system, are they considered exposed?
That's a good question. I don't think we've come across any guidance that would help with that. I think we'd want to talk that one out. For the most part, I think, boy.
Sorry to give you the hard one. I'm just thinking of classroom settings.
That's a good question. Let me take that back to our team.
Yeah,
I think for the most part, when we look at an indoor setting, at some point it's really hard to say this is exactly where they went in their path of travel, and then we start to look at that 2 hours. So I think we'd probably want to, I'll say right now, err on the side of caution and look at that. But, certainly I think if there is some sort of exactness where, this air circulation and there's barriers here.
Yeah, I mean, if the student's in classroom with other students, you know that, but next door or whatever it might be.
Yeah, we'd have to talk that out, but I want to say we'd err on the side of caution and note that publicly. I think the other thing is, and we've learned, folks travel throughout buildings, and sometimes we don't always know their exact locations. So I don't think we'd want to take that chance and miss something.
Yeah.
Any other questions?
Yeah, thank you. If
Thank you.
anything else comes up, please let us know.
All right.
Thank you.
Appreciate it. Thank you. Okay. Next, we're going to talk about the timeframes for our city and school elections for this fall.
I will be fast. But if you haven't heard, there is an election in November. Some of you may actually be on the ballot. So I just wanted to remind people in Iowa City and with school districts that likely your signature number requirement has changed because it changes every 2 years. So make sure you're checking it out. If you are short, you can't be on the ballot. Always a good idea to get extra signatures. Reach out to our office if you have any questions. But please, please, please do not turn in your paperwork at 5 p.m. on the very last day. We need time to read through it and contact you if there are any issues and get you time to fix it. So keep that in mind as you're turning in your paperwork. Everything is available on our website. You can call my office during business hours and we will walk you through it. So if you're unsure what you're doing. Otherwise, I will see you all in November on Election Day.
Thank you. Appreciate it. And I believe that's it. Do we have any other business?
Just one thing.
Yep.
Mayor Hoffman from North Liberty asked me to share that Jerry Keel passed away last night. Jerry is a former North Liberty City Council person and Mayor Pro Tem, and would be known to a number of people in this room. So we just wanted to let people know.
Thank you. Thank you for sharing that. Anything else? Okay, appreciate y'all. Thank you.
Thank you.